Okay, hi, my name is Lisa Adjin. I'm an executive assistant previously from the civil service. I now work for a public sector organisation. I have long COVID, initially after a mild infection in March 2020. I wasn't that ill, but I just never got better. After about 3 months, I realised there was an issue and I wasn't making it up. I tried to get some medical assistance, but it was really difficult to convince doctors that it wasn't anxiety or caused by the pandemic. My symptoms initially were quite simple, things like pins and needles, tinnitus, and shakes. But then it just started changing after about 3 months into like mad fatigue, so I couldn't get out of bed, post-exertional malaise, so if I did get out of bed afterwards, I wouldn't be able to go more than 5 meters walking. Then after 3 months later, worse, heart problems, breathing problems, no more mobility, neurological issues. There's a spectrum of different symptoms that I had over the last 22 months. I think the term lived experience means to me, what it means to me is like knowing and trusting your body and having confidence in what you feel, understanding your body well enough to know if something doesn't feel right, and using that knowledge to try and advocate for yourself. I had a lot of trouble trying to get assistance or help or even feel like I was believed. And I feel like the term lived experience kind of, it feels like it's heavy lifting. It gives me confidence of doing something positive with the illness that I've experienced. I'm not the kind of person to just take something. So when I got sick and no one was listening to me, I was reaching out, talking about it a lot. And actually made a lot of links and joined a group called the Long COVID Support Group. And I joined and became really active in that group, discussing my condition with others, but also taking a lead in trying to advocate for parliamentarians, government, doctors to listen to us and to take us seriously. Something that I did, I think after I'd been ill for just under a year, was created a long COVID clinic survey that was distributed via the Long COVID Support Facebook group. And that was a way of capturing other people's experiences of going to long COVID clinics, because my own personal experience was awful and I wanted to make sure that no one else had to experience what I had experienced. So I wanted to be able to evidence just how badly we were being treated as a group. And I'm an administrator. I use my work skills, so to speak, to just try and do something to make a difference. Well, I think it can mean so many different things, and one of the things that I do, I'm very proud that I can call myself a lived experience leader, because I would never have thought I could say something like that before about a health condition. But it's about what you know about the condition and how you deal with it. It doesn't even mean shouting the loudest. You can do as much or as little as possible, but whatever's right for you. I think it just means standing up for yourself and sharing your experience, not keeping it to yourself, speaking to others, whether they have a similar condition to yourself or not. In my journey, it was just firstly speaking out to other people who are going through the same thing, but then it was taking more of an interest to actually try and do something. So, I would research papers, I'd go on to the UK Parliament website and look up parliamentary questions about long COVID, so I can try and get a sense of what the authorities were, how they were dealing with it, or what they weren't doing, more so to speak. I've also kind of got in touch with various different people at such a wide community of people with lots of different talents. And that led me to getting in touch with Black Health Matters and eventually going on to the Lived Experience programme, which was really good. It was really good kind of development course, I feel. And although it wasn't teaching me anything really groundbreaking. It helped me to have confidence to communicate what had happened to me and to think about different ways of, communicating that out to the world. I think it was really good development kind of process to build confidence. Well, normally I don't stop talking about long COVID anyway. I want everybody to know. So I'm not to say I've loved being ill, but I have liked feeling like I've done something to make a difference. Someone I was telling about the work I was doing in the long COVID space said, "Oh, Alicia, when life gives you lemons, you make lemonade," and that's what I feel like the whole lived experience kind of process is about. Is trying to make the best of your situation and communicate to others to try and help them. I tell them to do it, definitely. It's something that I think in times of when you're going through something, an illness, no matter what type of illness it is, it can feel lonely. And I think going through that whole lived experience program helps you connect with other people that are going through something similar. It might not be the same illness, but they're all kind of dealing with something and trying to use that condition to better other people or to help other people. So I think everyone should do it as much or as little time as you can devote to try and to help whatever your condition is or anything that you're interested in and want to make a difference, no matter how big or small. Yeah, I think being on the programme, specifically like the sessions on social media, it really made me think twice about some of the things that I say, or just think twice before I say something, to think about how that message is being communicated, how it will be picked up by people with long COVID and without long COVID. Because sometimes I think previously I'd kind of been speaking out, but expecting everybody to kind of understand exactly what long COVID was and to feel the same like I felt. But that's not always the case. And if someone hasn't experienced it themselves or seen a close family member or friend having the experience of a prolonged health condition or chronic health illness, then they may not completely understand where you're coming from. So I think it was the program, the lived experience program, helped me to kind of be a bit more wiser about how I communicate and try and think about certain rules of using social media, and also to not overwork myself and feel like I have to do everything or I've got personal responsibility for things. As much or as little as you can do does help. I think I found out about the programme through after I did like a blog with the Black Back Health Matters team, and I just was so enthralled that there was people that wanted to support people like me, if you know what I mean, and just to give us a voice, a platform. So it was a no-brainer to do the course, and I'm really glad that I did. It was really good. It was really interesting to speak with different people that had different, lived experiences, because I hadn't ever got into the world of chronic illness. I didn't really know anything about it, and everyone's got different aspects. So like, the diabetes or even anxiety, it's not something that I would have previously have thought was a chronic illness, but actually everyone's having to deal with it in their lives and manage it. So that was a kind of an eye-opener for me. And it was really nice to just chat with other people, especially when we were going through like the whole pandemic lockdown phase. So it was nice to just meet different people and have a chat. And there was some kind of aspect of socialising, even if it was online. I think the key thing I learnt from the programme was to have confidence in myself and to understand that, to be a lived experience leader, I just have to talk about my lived experience. There was no special qualifications. I always used to qualify things that I would say about long COVID, qualify it with, I'm not a medical professional. And after doing this course, I don't do that anymore because I know enough about myself and my condition to be able to communicate about it.